Hey everyone, it's Mary Ann from the New York City Organization of Public Service Retirees. This is number 5. Chopping down that one big bit of video into small little videos. This is number 5. So let's just jump right back into that video of Michael Mulgrew. Here we go.
That's false. Okay. Second, there is nothing, and some of it's happened. I know I don't want to go into all the crazy social media stuff. This is very clear. Right now, there were conversations about offering that option, but this lawsuit isn't against us, the MLC. It's against the city. So the city says that the other lawyers will not involve, said they don't want to do it. So we're stuck.
This is not true. So, and I think I said this earlier. The Municipal Labor Committee filed an amicus, a friend of the court, taking the side of the city against its own retirees. He is intricately involved in this. He's had plenty to say about it as well. The lawyer, as I mentioned earlier in another video, is Alan Klinger, formerly of Strzok and Strzok and now of Steptoe. He is also the attorney for many of the unions, not just the United Federation of Teachers and DC 37 and sanitation, also the MLC. So, and it's interesting that he's now identifying himself as the MLC because he usually denies that. But yes, he is the MLC. And because he's one of the 2 largest unions, his vote weight and DC 37 can basically pass a motion to get whatever they want, even though there's 102 unions within the Municipal Labor Committee. Now, I want you to continue to listen to what he's saying because this is word salad.
Stuck. I want the option. The option should have been there at all times. Okay? That was taken away from us.
It wasn't taken away from you. You actually agreed to it. The Municipal Labor Committee, under the 1992 agreement, MLC agreement with the City of New York, must make agreements regarding all aspects of healthcare not in unison, but together with the City of New York. No party can make a unilateral decision. You can't say it was taken away from you, Mr. Mulgrew. You agreed to it because you knew if you did not agree to it, because of the decision that you made in the 14 agreement, were going to have to pay back the city for your collective bargaining values. You were extracting money from healthcare to finance your collective bargaining. So nothing was taken away from you. You allowed it to be negotiated because, look, you're labor. This is what I don't understand. Unions can put their foot down and say, nope, we're not doing it. And yet, you guys became corporatists. You became corporate unions, not labor. You weren't fighting for anybody, and you sure as heck weren't fighting for your retirees.
Okay, that's one of the reasons why we have to appeal the HiP rate and the option. We can't have either one of those things stand.
The HiP rate is what's protecting everybody. You need the HiP rate. The city will pay the full cost of health coverage up to the HiP HMO for every employee, retiree, and their dependent. You don't want the HiP rate now because you negotiated to suppress it, when that is the one number you should have left alone. You should not have suppressed it. You should have allowed it to go as high as wherever it was going. That is the benchmark, and it is statute. You had a law to protect you, but you didn't. So I don't understand. And then the choice, you negotiated away your choice, and then you blamed everybody else.
You have to keep fighting with us in this appeal process?
No, we can't fight with you because, first of all, the lawyers on that side are not us.
Okay, you could fight with us if you filed the amicus to support the retirees, which is what the people in this room wanted you to do. What you did was you filed an amicus, and you're not telling them, taking the side of the city. You filed an amicus on the side of the city against your own people, Mike. You did this. And under the cloak of the MLC, but you voted for it.
let me be clear. The law, I'm sorry, there's been so much bad information that everyone wants to believe it if you want to believe it. It's like the state of politics where I started. You'll believe whatever you want at this point. Okay? So this is very simple. Those lawyers are the only people who have control of that suit, not us. And we, the unions, we cannot allow, it will be very bad for us if we don't get overturned that everything is tied to the HIP rate.
And yet, that is the one thing that has been in place. How do you explain, Mike, that you have had the HIP rate and choice for 60 years? You've had it all, Mike. You had it all. You had the HIP rate and you had choice. You had it. You had it all. But you blew it because you blew the stabilization fund.
We have to get that overturned.
No, you don't.
That probably will cause a lot of damage to everyone,
No, it won't.
retiree and in service in the future.
No.
And that is the most dangerous thing that we have sitting on the table with that lawsuit.
No, I think the most dangerous thing we have sitting on the table is you and Henry Garrido and the Municipal Labor Committee.
HIP situation.
Because we never had that the HIP rate. Exactly. That's so this exactly. You had your option. The court just said everything's tied to the HIP rate. So
everything is tied to the HIP rate, and we still had an option. Where do you not understand that? This law passed in 1967. It's been around since 1968, effective on the books. Everything was governed by the HIP rate. Money, when the HIP rate was higher than the GHI rate, money went into the stabilization fund to finance it. When it was the other way around and the GHI rate was higher, money was supposed to come out to equalize it so that you did not have to pay the premium difference. When you imploded the stabilization fund, this is the mess that you got. And then you're pointing fingers every which way except to yourself. You should never have touched the stabilization fund for purposes other than it was intended. And when the fund was created, the documents specifically state what it was allowed to be used for. You allowed them to be used, the money in the stabilization fund to be used for purposes that it was never intended to be used for. That was your special savings account, so you did not have to pay premium. And there are many collective bargaining agreements that state that if the stabilization fund ever ran out of cash, that you would have to come up with ways to pay the premium difference between the benchmark, the HIP rate, and the GHI rate, or whatever plan it was that you wanted. And you know that because those provisions have been in those contracts for decades.
If GHI is higher than the HIP rate, the city's saying we don't have to pay for that anymore. That's why I keep saying.
Why were we able to keep?
But see, the city wasn't paying for it. It was the stabilization fund. Well, you know, I already said that you basically imploded.
What we had?
Because at this point, the city had come to us $500 million in 8 years, and the city was saying.
And we already know from the other video, the very first one, it's not $500 million for the Medicare eligible people. That is not an increased cost for Medicare eligible people. You basically robbed from the Medicare eligible people to finance the active worker under 65 plan.
We have to do something to figure out a way to absorb or get to a better place with how to do this. We said, let's set up a whole different system where we're fighting with the insurance companies in the hospital.
Which is interesting because, like, within the last 3 years, you just kept complaining about you were sick and tired of always constantly having to negotiate for healthcare. So why would you want to create a system where now you're fighting with everybody every year? This doesn't make any sense.
That was the decision we made. If you just kept saying, no, we just want what we want, we knew that sooner or later the city was going to say, it's way too high, we're not covering it. If we would have sued on that, we would have not tried to tie it to the HIP rate.
Well, it wasn't that no one tried to tie it to the HIP rate. That's been the law since 1967.
But we didn't sue. Somebody else did.
And of course, thank God we did, or we would have been screwed 3 years ago.
They're the ones who made the argument tying it to the HIP rate.
No, it is actually the law.
Bottom line, Michael, we retirees feel that you threw us under the bus.
Um,
That's the perception.
All right. So, well, thank you for saying that everyone agrees with you when it's clearly not true, but that's the way of the world right now.
So basically, Michael, this ends up that you are continuously spreading misinformation. I'm going to keep doing these because this is hopefully people will listen and try to fact check you. You never provide any evidence, any documentation, anything. I can prove that what the judge said. I can prove that you negotiated away our health benefits. I could prove that in 2016 you agreed to suppress the HiP rate, which was the benchmark. I can prove that the benchmark has been a statute since 1967. Provide us proof, Mike. Provide us proof. Because right now, none of it exists. Sorry. Have a good night, everyone.